Hello everyone, welcome to this class, DIT 2103, Computer Science 3. I'm Madam Linda Sawe from the School of Computing and Informatics, Department of Information Technology. This is a unit taught to diploma students taking health records, information technology. We are doing our first lesson today, and we will basically be introducing ourselves to terms that are related to information technology and information systems, trying to understand how information systems are important and of importance to health information systems or to health systems. So we'll start by defining a number of terms, and the first term I want us to define is what is a system. Now, systems are becoming very common now. We are using them in our organizations to do the different operations in every company's operations, or even in processing of our information, because systems are a bit fast, they are reliable, they are maybe giving us information that we can process and use to make decisions. So we'll define what is a system, and we say that a system is a set of components, that is subsystems or elementary parts, that operate together to achieve a common objective or multiple objectives. So every system has an objective it has to meet. It has a goal. It has a reason why we are creating it. So a system basically is a set of components that come together to perform a certain specific objective. Now, these objectives are realized in the output of the system. So what comes out of the system is usually the objective of that system. The second term I want us to define is information. Information is very critical in every system, and information is the data that has been processed and has been organized so that it has meaning and it's useful to the recipient of this information. So when we have raw data that we put into our system, it is processed to give us something that is of meaning. This thing that we are calling saying that it is of meaning is what we are calling information. Now, the third term, what we need to understand is the different categories of information, and there are three categories of information related to managerial levels and the decision makers that decision makers can use to make. So we have the three main levels of information. We have the lowest level of information as operational information, and this is information that we process on a daily basis as we carry out our operations in the organization. So when we are receiving information or like keying in information in our system that we are using to carry out our normal operations, like maybe in our student management system, registering of units, deregistering of units, maybe registering a new student, and so on. That is information at the lowest level of the organization, which is operational information. Then the next level, which is the second level of information, is the management control information. This is information that has been received on the operational level, but slightly processed to give reports. Reports that can be maybe on a monthly basis, reports that maybe can be on a semester basis for an institution like a university. So that information on that second level is what we are calling the management control information, and it's used in the middle level of the organization or the middle level of the management level. Then we have the highest level, which is the strategic information. Strategic information is the information that we use for long-term decision making. This is the information that is processed at the highest level of the organization, which is the strategic level, where we have our top level managers who make long-term decisions, people who make strategic decisions for the organization. So information falls on those three categories, the lowest level being the operational level, the second level being the management level, and the third level being the strategic level, which is the uppermost level of the organization. Now, you note that we use different types of systems to process this information. For the operational level, we have what we call the data processing systems, DPS, which is used to process daily information, the daily operational information that we get in our organization. Then in the second level, which is the management control information, we have a management information system for processing that kind of information. And in the highest level, we can use things like the decision support systems, like DSS, to process that kind of information. Then another important thing to note about managerial information is that this is the type of information that is required by the middle-level managers for short and intermediate range. For purposes of planning, maybe in terms of months. I've given an example of a university scenario whereby we may be processing information in regard to a semester. So in our middle-level management, like maybe the heads of the departments, they will process this information on a maybe semester basis or maybe on a monthly basis. This is in the managerial kind of information or in the managerial level. Then we also look at examples like sales analysis, maybe in a company whereby we are dealing with sales. Maybe in a supermarket scenario, for example, when they do their sales analysis, they are processing managerial kind of information. We have cash flow projection. We have annual financial statements. So depending on the kind of organization and what we are dealing with, we will have different forms of managerial kind of information. Then it's also achieved with the aid of a management information system, as I've earlier said. Then the other level, which I said is the operational level kind of information, we are calling it the operational information. And this type of information is required by low management for daily and short-term kind of planning. So the kind of information that we process on a daily basis, the kind of information we use for short-term planning of the organizational processes is what we are calling the operational kind of information. And then an example is like maybe keeping employee attendance records on how they are attending work, overdue purchase orders, and even current stocks that are available. Now, this is achieved using a DPS. A DPS here is a data processing kind of system that processes daily data that we pump in or key into the system. Then the third thing I want us to define is what is an information system. We've defined what is a system. We've defined what is an information. Now, what is an information system? The word information system is using the two words, information and system. We've said information is data that has been processed and is of meaning. A system, on the other hand, is several components or subsystems that come together. So an information system is a set of interrelated components that collects or retrieves, processes, stores and distributes information to support decision making or even coordination and even control in an organization. So that system or that set of components that have come together for purposes of retrieving information, processing information, storing information, distributing information to support decision making, coordination and control in an organization is what we are calling an information system. Now, information systems help managers and workers to analyze problems, to solve complex issues, and to create new products. So basically, an information system will help managers. It will help people in the organization to make right decisions, to help solve problems, analyze the kind of problems they are dealing with, solve complex issues that they may be experiencing, and of course, remain strategic by maybe coming up with new products, new services that they are supposed to be providing to their customers and even clients. Then an information system contains information about people, places, and things within the organization and its environment. Then it's good to also understand what is data. Now, data is basically elementary or basic description of things, events, or activities and transactions that occur in an organization. Now, before it has been organized and arranged into a form that people can understand and use, basically it's raw. We can say it is just raw facts that we have collected, and we need to process it to be able to give us some kind of useful information. So that elementary or basic description of things, maybe activities or events that we have in our organization is what we are calling data. Then we have another important concept, which is knowledge. Now, knowledge is data and information that has been organized and processed to convey an understanding of experience, accumulated learning, and expertise if they apply to current programs or activities. Now, this is information that has been processed to a higher level to be able to convey some kind of understanding, some kind of experience. So we may have some knowledge processing kind of systems to give us more information, more knowledge, more experience, maybe even project some kind of prediction and so on. So knowledge has a very high potential value for the user. So knowledge is something bigger, or something that has been processed to give you even more picture about a scenario or a situation. Then let's look at the activities of an information system. Now, an information system produces information that an organization needs to make decisions, to control its operations, to analyze problems, and to create new products or services. Now, these are basically the things that any information system endeavors to do for you. An information system will need to help you make decisions, and decisions that are worthwhile. It will allow you to make control in operations. It will also allow you to analyze problems that you have in an organization, and to even create new products and services to remain relevant in the market. Now, in order to do this, the information system performs three main activities. So every information system has the input, which is what we key into the system. It has the processing. What is it doing? What is the goal of that particular information system? What is the objective of that particular information system? If it's a computer system, for example, converting the data that we are keying into information is what we are calling the processing. If it's a company that is helping in maybe prediction, that process of doing the random prediction is what we are calling processing. And then the output. Remember, the output is guided by the objectives of that system. So every system must have the input, the processing, and then the output. Now, there's a small diagram here to represent those main activities and components that make up an information system. We have the input, which can be data. It can be information or an instruction. Then the processing, we can be doing sorting, we can be averaging, we can be doing totaling, we can be doing analyzing, we can be doing classification. Then the output can be in the form of a report. It can be a receipt if it's a sales management kind of system. It can be a graphics if maybe we are doing a weather forecasting kind of thing, or any kind of representation of data, maybe using graphs, maybe using pictorial representations, maybe using an analyzing kind of software, and so on. Then a system will have the organization which it is carrying out the different operations for, and then a boundary. Every system has a boundary, and the boundary defines the scope of that system. So it's just good to realize that every information system has those three main components. We have input, we have processing, and we have output. Then let's see what input is. Input is basically collecting of raw data from within an organization or from the external environment. Now, there are the elements that enter the system. For example, raw materials entering a chemical plant, patient admitted in hospital, data input into a computer, and such like things. Then the processing is basically the conversion of the raw data or input into a meaningful form, which is an output. It's all elements are necessary to convert or transform input into output. Then it also includes adding. You can be totaling, you can be sorting, you can be calculating, analyzing, arranging, and classifying, or averaging, or maybe manipulating some data. Then the output is basically what comes out of a system. It's transferring the processed information to the people who will use, or to the activities for which it will be used. Then it's the finished product, basically, that comes out of our information system. For example, a chemical plant, the output would be fertilizers. Maybe in a computer system, the output may be reports, invoices, or graphics. Then we have what we call feedback. Sometimes the output that comes out of the information system is used as input. So this is where the output is returned to the appropriate people in an organization to help them evaluate or to correct the input stage. So sometimes what comes out of the system informs how we will be carrying out our operations, or maybe what we need to adjust in our organization. That is what we are calling feedback. Now, the other activity or the other component of every information system is the word environment. Now, these are the elements that lie outside the system and have a significant impact on the system performance and in the attainment of its goals. Now, sometimes we may have parts of our organization that are not necessarily within, but they affect how we carry out our operations in one way or another. This is what we are calling the environment of the information system. Now, they include things like what? Our suppliers or supplies, our customers, the government, the competitors that we have, our stock and stakeholders. All these are people who are not necessarily within the organization, but they affect how we carry out our operations. Maybe how they maybe tell us how to change, or maybe how we can attain our goal, and so on. Then we have boundary. This is the line that separates the system from the environment. We have the inside of the system and what we are calling the environment. That line that distinguishes the two, within the organization and the environment of the organization, is what we are calling the boundary. Then the system is inside the boundary, while the environment lies outside the boundary. Then the boundary can be physical or non-physical. For example, our system can be bound by time. So time here is our boundary in this case. Then let's now understand what is a health information system. Remember, this is a unit for students studying health records, so it's good to bring in the line where information systems is coming in or getting into the health sector. Most of the health facilities now are using systems to manipulate their data and to even process their data, to manage their patient data. So it's important to understand what's a health information system. We have understood what is an information system. Now let's try and see where health and information systems are meeting or are interlinked in this case. Now, this is a system that captures, stores, transmits, or otherwise manages healthcare data or activities. So that system that is dedicated to either capture, to store, to transmit, or to manage healthcare kind of data is what we are calling a health information system. Now, these systems are used to collect, to process, to use, to store, to manage, to report health information, and transmit a patient's electronic medical records. Then information from a health information system can be used to drive policy, to make decisions, to research, and ultimately to maybe process health kind of outcomes from our system. So a health information system is basically an information system that is dedicated to process healthcare kind of data or healthcare kind of information. Now, let's look at the key components of a health information system. Now, a health information system consists of 6 key components. Number 1 is indicators. Now, this is a complete set of indicators and the relevant targets, including what? The input of our system, which is whatever we are feeding into the health information system. The output, the outcomes, the determinants of health, and the health status indicators. So all that information that we're either keying into the system, getting out of the system, using to manipulate or to process this healthcare kind of data is what we are calling indicators. We also have what we call data sources, which include both the population, which is our population generally, or the institution-based kind of data sources. The institution-based in this case is the information that is coming in from our health facility. Then we have data management, which is that process of maybe collecting and storing of our data and even managing the flow of how that data is flowing in our system, and even compiling and analyzing this data. So data management is big. How are we collecting the data? How are we storing it? How are we analyzing that data? How are we even retrieving that data from our system? So that's a very important aspect in our health information system, whereby we need to understand how the data will be managed. The other component is information products. Now, this is the data that will be analyzed or presented during as we process our information or as we process our data in our system. So information products is how we will represent that. How will the data be analyzed? How will it be presented? Then we have dissemination of information. This is the process of making data available to decision makers. Decision makers are people who are involved in maybe coming up with strategic kind of decisions for the organization, either long-term, short-term, whatever decision that needs to be made, it's made based on information that we have. So how is that information disseminated? Then we have, how will the information be in use also? So this is the process of facilitating the use of that information. Once we've processed the information, how will it be of importance to us? How will we use that information? So that is very important. Then let's look at the types of health information systems. We have the first one is the strategic or operational systems. Now, these are systems that are typically used for information classification. Now, one thing that we can do with information is to do classification or to classify our information. So the system that is dedicated to do that classification is what we are calling a strategic or an operational kind of information. Operational system. Then we have clinical and administrative systems for managing patient information on an administrative level. Remember, we are dealing with patient information here. It's a health information kind of system. So clinical systems that are dependent on administrative kind of data for purposes of maybe managing or processing patient information is what we are calling the clinical and administrative systems for managing patient information on an administrative level. Then we have EHR, which is electronic health record and patient health record. Now, these are basically systems that aim to enable semantic and interoperability for health information systems between various electronic health records and even non-proprietary format to vendor lock-in. So those systems that are dedicated to processing electronic health records or even patient information records fall in that category. Then we have what we are calling the subject and task-based kind of systems. Now, these are systems that are related to patients or healthcare professions in any type of healthcare organization. So any healthcare organization has their health workers, which is very important. Who is doing what? So it's subject and task-based. We have different sections in our hospitals and different personnel in every of that section. So task-based systems, on the other hand, are associated with particular tasks such as admission, discharge, maybe who is in the lab, maybe the technologists at the lab, and so on. So this is based on tasks and subjects. And then we have financial and clinical health information systems. These are systems that provide easy access to patient financial information, such as costs, payrolls maybe, and they also aid in monitoring patient usage of different departments or services in the hospital. You may find that a patient has accessed maybe the scanning facilities, maybe the lab facilities, and so on. So as you can use this kind of systems to manage what services have been offered to a patient. And then the next or the last type of health information system is a DSS, the decision support kind of system. Now, decision support systems are used in the highest level of the organization, which we are calling the strategic level, as we had earlier seen. Now, a decision support system converts data to clinically relevant information and present it in an actionable form to clinicians, aiding in adherence to regulatory guidelines and best practices. Now, decision supports come with a capability of helping in making decisions. These decisions can be used by our top level managers, or maybe our clinicians, or maybe our different health workers to make certain decisions, to adhere to certain policies that are there, or certain guidelines, or even to adhere to some best practices. So these are systems that help us with some form of decision-making capabilities so that we are able to provide services according to the policies that are there, according to the regulatory guidelines that we have, and even best practices. Now, what are some of the examples of health information systems? We have Master Patient Index, MPI, which are used basically to store and monitor some patient characteristics, or some patient issues, or some very critical things that you can measure about a patient. Then we have the medical billing software. As the name suggests, these are used for processing medical bills. Then we have patient portals, which are basically each of the patient's records are kept in there, or every patient's records are kept in there, only the historical information, what they have received or what services they've received in the hospital, and so on. Then we have Health Information Exchange, which is used to exchange or to send and to process health records or health information that maybe a patient could be having. It can be sent from one hospital facility to another. Then we have activity-based costing, maybe the different activities in the hospital and how they are costed. Then we have the patient-reported outcomes, which will have reports on every service that a patient is receiving and what outcome has come out of that service, whether positive, whether negative, whether there is progress, maybe you may need more tests, and so on. This is used to monitor such kind of activities. Then we have remote patient monitoring. Maybe some patients require some monitoring of maybe their blood pressure, maybe monitoring of their maybe pulses, and so on. So we may have remote patient monitoring kind of systems, which are computerized kind of systems, maybe to monitor the way they are breathing, maybe to monitor their oxygen level and such like things. Then we have scheduling software. We book appointments nowadays to go to a hospital facility or to see a doctor. You may need to do the booking earlier. So we have scheduling kind of software to know who is available at what time, who is coming in at what time, which doctor is available at which time, and so on. Then we have e-prescribing software, which are electronic software programs that are used for prescription. As you've gotten treatment, which drug is prescribed to you, or which medical medicine do you require, and so on. Then we have laboratory information systems for maybe managing and processing of lab kind of test results, and so on. Maybe for keying in components or for keying in samples, and so on, we have to use a laboratory maybe information system. Then we have our hospital patient administration system, which is basically used for management of patient details, patients who are admitted into the hospital, and so on. Then we have the human resource management information system, which may be used by the human resource in any hospital facility for management of data of their human resource, management data of their payroll system, and so on. Then what are some of the challenges of a health information system? One is that a health information system must be both user-friendly, otherwise staff simply won't use them, and they should be cost-effective to run. Now, every system must be user-friendly. And when we say user-friendly, is that it should be good and fair to the user. The user should not have trouble using this system. Remember, an information system is supposed to make work easier. So if a system is so hard to use, it is stressing the user to use. The user is having so many errors when using them. That is not a user-friendly kind of system. So our health information system must be a system that is easy to use for the user. The user can easily interact with it without any issues. So the user is able to maybe carry out tasks very fast in that system. Then again, the system must be cost effective. It must not use a lot of our resources. It must not be very difficult to recover or to get it running. Backup should be easy. So a system should be cost effective and efficient. Then we have, they should also be able to use and interpret health data. Now, health data is not any data. It's very important data. It's data that is very, very critical here. So managing and using a health information system should be easy with this kind of data, and it should be able to interpret that kind of data. Then there's a note there that, however, achieving this has been a challenge, of course, because health data here is not any data. It is data that has to be processed very keenly. Then leading the industry to aim for interoperability, which is crucial for maximizing the benefits of health information systems. Then the other challenge here is interoperability, which improves both the quality and use of health information systems or health information. But traditionally, integration techniques are costly and time-consuming to implement. So getting that interoperability is still a challenge for that reason, because again, traditional integration techniques are costly. They're very expensive here, and they may take a lot of time. Then what are some of the benefits then of a health information system? The main one is data analytics. Now we are moving to a point whereby analyzing data and mining data that or making good use of the data and information that we have collected is very critical for every organization. So most health information systems are used for analytics and data analytics in this case. Now, the healthcare industry constantly produces data. Now, health information systems help to gather, to compile, and to analyze health data to help manage population health and reduce healthcare costs. So information is vital. Information is very critical here. So we use that information that we have collected to make decisions, to know the future, to maybe predict, to know our trends. Like now in the case of COVID-19, we are getting to know our trends in the future because we have data analytic techniques or data analytic kind of softwares. We are able to predict what is coming ahead, how are we doing, and so on. Then we have collaborative care. And here, patients often need to get treatment maybe from different healthcare providers. So that capability of being able to maybe exchange information and send information from different healthcare facilities is what we are calling collaborative care, so that a patient can visit different hospitals in different places, and that their information is already there or can be sent there very easily without necessarily the patient having to provide that information. So here we have, it will allow healthcare facilities to access common health records. Then the other advantage here is cost control. Now, when we have regional markets using healthcare information exchange to share data, healthcare providers see reduced cost. Information is very important. That being able to exchange information easily within a very a small thing as simple as just sending information electronically, we see a lot of reduced cost. We don't print. We don't have to have our scans in paper and so on. We just simply transmit that information electronically. That will reduce costs highly. Then we have population health management. Health information systems can aggregate patient data, analyze it, and even identify trends in population. So we have, with that processing or with that system that we are using to process our information, we are able to predict some things. We are able to see trends and so on. Then clinical decision support systems can use big data to help diagnose individual patients and treat them. We are also using health information systems for maybe diagnosis. We are using it for prescription. So that is something very good, where we're having good population health management, whereby we are able to use systems to do actual or to solve actual problems, in this case, like prescription, maybe diagnosis, maybe recommendations for the future, and so on. Then, what are some of the best practices in health information systems? Now, The health insurance portability and accountability hyper regulates the protection of individual healthcare information. Now, healthcare information is highly confidential. We have to keep privacy of the patient data. So hyper here defines or regulates how patient information should be protected, how patient information should be kept confidential, how patient information should be kept private. So to help keep systems secure, of course we have to secure our systems because we have very confidential information in our systems, in this case in our health information system. How can we achieve it? What are some of the best practices to do? One is you need to train your employees. Ensure that your employees are empowered. They know the importance of securing your computers, maybe with a password. They know the importance of sending information via secure channel. They know the information, the issues are the consequences of sharing patient information anyhow to anyone. They know how to maybe pass information, how to relay information, so that our patient and even their relatives maybe they don't feel offended. They don't feel like their privacy is being infringed into, or their confidentiality is put at risk. So it is very important that you need to train your employees on key issues regarding patient information. Then number two is it's good to encrypt data. Encryption is that process of hiding information before it can be transmitted or before it can be sent from one point to another. Now, that hiding uses algorithms that we call encryption algorithms. We don't send text as plain as it is. You hide the information that is sent before it can be sent via a channel, especially if you're suspecting that that channel is not very secure. So it is good to always use systems that have encryption embedded in them. Then we have backup your data. Systems are bound to fail. Sometimes systems are systems are human. They are created by or they are man-made, so they are bound to fail. So it is good to always have a backup. Maybe you plan on a daily kind of backup, or maybe a weekly, or maybe on a monthly kind of basis. You need to plan how backup is done, so that in case our systems fail, we have a backup of the information that our system is holding. Then we have monitor usage. It's good to know how your system is using your resources. Resources here could be the computer resources and even the organization's resources. You would not want to have a system that is very expensive, that is not efficient, that is not cost effective. It's good to have a system that is cost effective, and you can only know that by monitoring how the usage of the system is and even who is doing what in the system. You need to be in control so that you don't have intruders accessing the system without your knowledge, so that you don't have your system failing on some part and you don't have knowledge. So it's good to monitor who is using the system to do what and such like things. Then we have buy insurance. It's good to insure your system so that you're having insurance against any form of risk. Systems are risky. And in any organization, we need to plan for how we are ready for risks, how to mitigate risks, how to prevent risks, and how to even come out of a risky situation. Then we have access vendor vulnerability. It's good to train your vendors on the vulnerabilities that are in the system. Things like hacking, viruses, and such like things. It's good to know that our systems can get or are vulnerable to some issues like viruses in that case, hacking, denial of service, and such like things. Then we have utilize multi-factor authentication. Authentication here is that process of confirming that the access we are trying to gain into the system is actually authorized kind of access. Have different levels of authentication, maybe secondary authentication, whereby it's not just about a username and a password. Maybe you can have a secondary level of authenticating that this is a legit access request, or this is a legit person trying to access the system. Then we need to move on to the next topic, which is organizational structures. We've been talking about organizations in our previous slides. It's good to understand how organizations are structured, or how organizations are planned, or how organizations are put in different hierarchy or levels. So an organizational structure outlines how certain activities are directed to achieve the goal of an organization. So every organization has a goal. Like our university has a goal in research, in training, and such like things. So how we have structured the different activities of our organization in order to achieve these activities or goals is what we are calling organizational structures. Now, successful organizational structures defines each employee's job and how it fits within the overall system. So having that clear description of what employee is doing what in the organization, at what level are they, and such like things is what we are calling an organizational structure. And that is very important for the success of every organization. Then a centralized structure has a defined chain of command, while a decentralized structure gives almost every employee receiving a high level of personal agency. So we may have a centralized kind of structure or a decentralized kind of structure, and a centralized kind of structure has a command where we have a clear line of command, whereas a decentralized kind of structure is like a flattened kind of structure whereby every employee has maybe an equal right or a high level to receiving or maybe issuing commands. Then we have a number of types of organizational structures. We have the functional structure, which is dividing the firm or the organization into departments that maybe consist of things like marketing, sales, operations, which is basically a way of maybe dividing our organization into departments or even different functional units, depending on what each of the department is using or what each of the department is doing. So here we divide our organization in terms of functional units, like maybe marketing, maybe sales, maybe operations, and such like things. And we have the divisional or multi-divisional kind of structure. This is whereby the company structures itself so that each business unit operates as its own company with its own president. It can have a director. It can have maybe a head of department and such like things. So in the organization, we divide the organization into structures that we are calling divisional units or maybe multi-divisional units. And each of the department operates on its own. We can look at our university and the campuses as the divisions. So each of the campus has its own director. It has maybe its own principal and such like things, and they're operating on their own. That is what we call the divisional or the multi-divisional structure. Then we have the flatarchy kind of structure whereby we don't have any levels. We are all on one level. So it flattens the hierarchy and chain of command and gives its employees a lot of autonomy. So we are all operating on the same level, no chain of command, no top-down or bottom-up kind of approach in the organization. So we've seen the dividing it according to functional units, according to divisions, and according to maybe flattening it so that we don't have the different levels. And then we have the last one, which is called the matrix structure. Now, this structure matrices employees across different superiors, divisions, or departments. So an employee working for a matrix company, for example, may have duties in both sales and customer service. So you may have a situation whereby you are matrixing or categorizing employees according to their specialty. So that maybe if I'm good in IT, I can be working, doing my IT or giving my IT skills in the different sections of our organization, maybe in the sales department, in the accounts department, in the customer service department. So I'm cutting across and providing my skill in the different sections of the organization. So you are simply putting employees in matrices, in this case, according to maybe their specialty, or maybe their skill, or maybe whatever service they're offering. And you can find that an employee is providing that same service that they are good at in the different departments or in the different divisions that we have in the organization. Now let's look at the process of maybe coming up with the organizational structures. So the first thing you need to do is maybe to come up with a job design. You have to know what departments are involved in our, or what is our job description basically here. What is there in our organization. Then you need to put the different attributes that you have identified in departments, do delegation, span into management, and then provide or have a clear description of how there's a chain of command, how commands are being issued in the organization. Now, we'll define the processes in the next slide here. We have, number one, you have to review plans and objectives. Every organization has an yearly plan, maybe a 5-year plan and so on. So it's good to have a clear description of the plans and the objectives of the organization. So the objectives are the specific activities that must be completed to achieve the goals of the organization, and then plans shape the activities needed to reach those goals. So it's good to have plans and objectives of the organization. After that, determine the work activities necessary to accomplish the objectives. Have a clear layout of the different work perspectives or the different work that should be done so as to get to the goals of the organization as identified in the first step. So managers simply list and analyze all the tasks that need to be accomplished in order to reach the organization's goal. So each of the managers in the different departments, in the different divisions, need to identify what should be done to reach the organization's goal or the target of that organization in terms of the objective and the goals. After that, you need to classify and group the necessary work activities into manageable units. Divide the activities you have identified into categories or into groups so that you know what team will work on what. So a manager can group activities based on 4 models of departmentalization, maybe in terms of function, in terms of location, geographically, the product, or customers. So you may decide to group your different activities according to function, what is being done here, who is doing what, maybe geographical location, where is that service or where is that request coming from, then product, who is it serving, what kind of product are we dealing with, or maybe customers here, where what is your client requesting or what is your customer requesting. Then after that, you need to assign activities and delegate authority. You have grouped the activities maybe according to the functions, maybe according to the customers, maybe according to the product. Now you need to delegate that work to a certain group. So managers assign the defined work activities to specific individuals. Now also they give each individual the authority or the right to carry out the assigned tasks. If you have a system that you need to use a system to do it, maybe you have to give them rights of the system. If it's a certain module, say the examination module, you may need to have people assigned the rights. Maybe if it's marketing kind of task, you need to give them the marketing rights and the things they require to carry out that operation. Then we have design a hierarchy of relationships. So know what is linked to what. So a manager should determine the vertical, which is the decision making, and the horizontal, which is coordination relationships of the organization as a whole. So it's good to know so that you know who are you reporting to. How are the reports being done? How is the commands or chain of commands? So it's good for the manager to also be in control so that they know who is issuing commands, who is reporting to who, how are we getting the consolidated reports of the different activities and such like things. Then to manage these organizational processes, we use flowcharts. So it's good for us to understand what flowcharts are. And we'll define what flowcharts are. And flowcharts are easy to understand diagrams that show the steps of a process or the steps of an activity and how that activity fits together. So we can use flowcharts basically when you are processing information in an organization and trying to analyze that information so that we are able to make decisions, so that we are able to understand how the different process activities are being carried out. Then flowcharts are simple diagrams that map out a process. A process in this case can be an activity. It can be the goal of your organization and so on. So we can use flowcharts to maybe understand or to map out or to try and figure out how a process is being carried out so that you can easily communicate it to other people or to other or fellow employees in the organization. Now, flowcharts tend to consist of 4 main symbols. So we have, and this is a diagrammatic way, so we use symbols. And the 4 common symbols that are used, and the symbols are connected with arrows, are, we have the first one, which is the elongated circles, or maybe we can call them the rounded kind of rectangle. And this usually signifies the start and the end of a process. So every flowchart starts with this symbol, and the one that is at the start is usually labeled as start. The one at the end can be stop or end, depending on how you want to call it. So this is the first symbol that normally starts for every flowchart, and at the end we end with the end symbol or stop symbol. Now the second symbol is the rectangle, and the rectangle shows the instruction. It shows the action that is being carried out. What is happening at that particular point? If we are processing, if we are maybe averaging, if we are classifying, we are grouping data together, we use a rectangle to show a certain operation, a certain activity, a certain task, a certain instruction that is being carried out in a process. Then we have the third symbol, which is a diamond, and this is used where we are making decisions. We are making a decision. We use the diamond symbol. The diamond symbol is represented there. And something very important to note, the decision we are making will be inside that diamond symbol. And then the arrows that leave a diamond symbol cannot be less than 2. We are making a decision. It means we are branching to different branches depending on how the situation or the decision is being met, or the condition in the decision is being met. So, and again, the arrows that leave the decision symbol have to clearly be labeled. It can be a yes, no, true, false, depending on the kind of decision that we are making. So here we are seeing an example here where we have the decision there, and we have a yes arrow going down and a no arrow going to the right. So it's important to note that for every decision symbol, you should clearly label the branches depending on the decisions that we are making in that case. Then the next symbol, which is the last one, is a parallelogram symbol, which shows the input and the output. We've said that for every system, we always have an input and an output. So if you are inputting something into the symbol, into this flowchart, we will use that symbol. If we are outputting something from that system again, or maybe from a process, we will use the parallelogram symbol. So this is used to just denote or to show what we are either inputting into the process or outputting from a process. Then how are we using flowcharts? We use, or organizational flowcharts are used for defining a process, standardizing a process, communicating a process, identifying bottlenecks or waste in a process, solving a problem, or improving a process. So you notice we're using the word process a lot. We had earlier defined that flowcharts are used to diagrammatically represent the different processes in an activity in an organization. So we can use flowcharts for these purposes. You want to define a process. You want to explain to us what a process entails. what a process contains, what are the different activities that go into that process. That's what we are saying a flowchart can be used for. It can be used to standardize a process. It can be used to communicate a process. Maybe you're trying to explain what is contained in a process. Then it can be used to identify bottlenecks or waste in a process. Remember, an organization endeavors to minimize any waste, remove any bottlenecks that are in the system. You can be using a flowchart to illustrate these bottlenecks or waste. Then we can also use a flowchart to solve a problem. It can be used to represent an algorithm. And you know that an algorithm will identify the different steps that go into solving a problem. So you can use a flowchart to relay that, or to show an algorithm, or to show the steps that go into solving a problem. Then we have improve a process. Maybe you want to add something or remove something into a process. You can use a flowchart to illustrate that. Now, how can you create a flowchart? To create a flowchart, you can follow the following simple steps. One, you need to identify the tasks in that process. So you need to list down all the tasks in a process in a chronological order, in the order in which they occur. What activity comes first? What task comes second? What task come afterwards, and so on. Then you need to ask yourself questions like, what happens next in the process? We are done with task 1. Where do we go to? Do we go to task 2? Do we go to task 3? And so on. And what happens in case we have to make a decision? So do you need to make a decision before or after the next step, and so on? Or what approvals are required before you can move on to the next task? So it's good to ask yourself these questions as you are planning how the tasks will be ordered, to avoid making a mistake, to avoid creating a bottleneck, to avoid creating another problem, to avoid errors during processing. So it's good to plan well, or in chronological order, the way the activities will appear. After that, you move to step 2. You need to organize and document the tasks. So in this case, you start your flowchart by drawing the elongated circle, which we have said we'll label it as start, to show that this is where the flowchart is starting. And then now focus, or then work through your whole process. You have identified the tasks. You need to know what symbols you're using for each of the tasks. Then now move on to figuring out, or to planning how you're continuing with your flowchart. Know what actions require decisions. What order are the tasks coming in? Then you link them with arrows to illustrate the flow of information in that particular process. After that, you need to cross-check. Do a double check of the process. Ensure that you are done double checking, because we are human, we are prone to make mistakes, we are prone to make errors or do errors. So it's good to cross-check so that you are not misrepresenting your activities or your tasks in an order that is not appropriate. So when you have completed your flowchart, go back to the start and try it out to make sure that you haven't overlooked anything. Overlooking something will mean you've skipped a task. You've skipped a very important thing in the process. So it's good to double check. Then work through each step and ask yourself whether you have represented the sequence of actions and the decisions involved correctly. So ensure that the order of tasks is okay. Ensure that the decisions to be made have been factored in. Then you see that the information is flowing well. Then you ensure that your flowchart is okay. Then let's look at a small example of a flowchart, and we will be representing or showing a part of a flowchart that represents how a receptionist is able to maybe route incoming phone calls to a company to the correct department. So we know as a receptionist receives calls and then channels the calls to the correct department, or channels the customer requests or customer inquiries to the correct department so that the customer gets help. So let's just see that scenario, or see how that can be represented in a flowchart. So we have the flowchart represented here, and the flowchart starts with the start symbol. We've said the start symbol is represented with an elongated circle or maybe a rounded-ended kind of rectangle. You see it starts with start, and then the arrow leaves the start symbol. We go to the next symbol, which is the process symbol or the activity symbol or the instruction symbol. And the instruction that we are having here is answer the phone. The phone call is coming in. The receptionist is supposed to answer that phone call. Then we have a decision being made there. That's why we have the decision symbol. And the decision symbol is basically a query where we are asking our customer what help do they need. How can they be helped or assisted? Now, in this case, we have the first scenario can be the customer wants some kind of information or maybe some kind of service. So you need to take down the name of the customer and the company. In this case, they are placing an order, so you channel it to the right department where they can place their order. And after that, they will be asked for the name of the company and maybe the details of their order, and then it is processed and you finish that task. Alternative B is where maybe we are directing them to shipping. Now, shipping is connected to number 3 here, which is a connector that will have the shipping process. Then we will have another situation whereby it's a customer service kind of query. It has to go through a decision again, then the service is provided and we finish. Then we may have others, maybe another department, we may have the billing. Then you notice that we have introduced a new symbol which is labeled 1, 2, 3. Those are connectors and they can be used to extend a flowchart to another part. So the billing will be represented by connector number 2. So you will have another part of the flowchart with 2 listing the sequence of activities in the billing. We have the other linked to connector 1. Connector 1 will be representing the other sequence of activities. We have shipping is connected to connector number 3. Now shipping will have that process or that activity that goes into shipping denoted by connector number 3. So this is just a simple kind of flowchart or a simple example of a flowchart with the 3 basic symbols we've looked at, the start and the finish, or the start and the end, or stop, depending on how you want to represent it. In our case, we have finish, denoting the start and the end of the flowchart. We have the rectangles for the different activities or tasks in the process. We have the decision symbols that are used for making decisions. Note something, the arrows leaving a decision symbol must clearly be labeled so that you know, or so that whoever is reading through your flowchart is not lost. They know where to find what kind of information. So it is very important that every arrow that leaves a decision symbol is clearly labeled. Then we have the connector symbol that we've introduced here, and connector is simply used to connect different parts of a flowchart so that somebody is not lost. You know, number 1 is coming from the other category, 2 is coming from billing, 3 is coming from shipping, and so on. So we'll stop there for today. That's the end of our lesson 1. We'll continue from there next time. Thank you.
These televised lectures supplement our robust online learning going on our MKU online platform. You can view more on our televised lectures via our online platform. We are in a digital era, and Mount Kenya University knows this. The following are the steps to follow so as to complete your online application. Download the application form from the website www.mku.ac.ke. Attach copies of your academic certificates and ID. Pay the application fees via M-Pesa pay bill number 270988. Your ID is the account number. 2,000 shillings is the charge for a postgraduate. You can also deposit in the bank accounts provided on the website. Then email all the above to apply@mku.ac.ke.